the splenius muscle. Then we have trapezius muscle right here. As I reflect the trapezius, I'm going to see the rhomboideus muscle, okay, as well as we see the omotransversalis right here and brachiocephalicus right here. But I showed you two muscles here, but we don't really see two muscles. Do we really see two muscles here? Okay, we only see this as one big muscle. Okay, but remember, here we have some demarcation between these two. In the horse, these two muscles would be completely fused with each other. It is very difficult to separate those from each other, as we can really do very easily in the dog as well as in the ruminants. But in the horse, we cannot really separate brachiocephalicus and omotransversalis from each other. So whenever we wanted to do something on that, we have to do both of these muscles together. Even if you want to transect something, we transected both of them together. In our lab manual, they advise to see like if you can really make some artificial demarcation between these two and separate them from each other. But that doesn't really, not really necessary, so we just decided to keep them together and then just incise them together whenever we need it. Okay, so these are the lateral muscles. That's the dorsal border of the omotransversalis, and we see that nerve coming off, or that is dorsal branch of the accessory nerve, and that's going to go in a zigzag manner. That's going to go back to the trapezius muscle. Okay, so on the other side, more superficially, we saw great auricular nerve, which is branch of C2, and here we saw the dorsal branch of the accessory nerve, which is innervation for the trapezius muscle, which is not very different from any other mammal, or we can say animal. Okay, both of those are very similar in other animals too. The great auricular nerve may be a little bit important because sometimes when you see facial paralysis, the greater auricular nerve still has innervation to the ear, and ears would be pulled backward. They cannot be pulled forward because the cranial muscles are paralyzed, but they would just remain pulled backward because the greater auricular nerve is still functional, and that is innervating the muscles on the caudal aspect of the base of the ear. Okay, so that's your dorsal branch of the accessory nerve, omotransversalis muscle, brachiocephalicus muscle. That's the jugular groove with external jugular vein. Here, that animal was injected, or we can say venipuncture was done just before animal died, so there was no time for resorption of the blood and all whatever is present in the visceral space of the neck. Okay, and that bleeding is going to be there every time you inject or you inject into the external jugular vein. Okay, fortunately, external jugular vein is not present within the visceral space of the neck. So any bleeding or any infection, if occurs there, it won't go right into the visceral space of the neck. Okay, but we need to avoid any entry into the visceral space. What is the relation between the deep fascia of the neck and the endothoracic fascia? It is eventually continued with each other. So any deep injury in the neck region, if it goes to the visceral space of the neck, that infection might spread into the thoracic cavity. Even the deep fascia between the muscles of the neck, that can also lead that infection to the endothoracic fascia and to the thoracic cavity. Okay, so any deep wound or maybe prolonged infection or inflammation in the neck should be considered seriously and then should be treated as quickly as possible. Okay, so we saw the jugular groove with external jugular vein inside it, and then that muscle is your sternocephalicus muscle. That's your brachiocephalicus with cleidomastoid portion, and this is your cleidobrachialis portion. Cleidobrachialis, that part is going to insert on the humerus along with the deltoid tuberosity as well as along the crest of the humerus. But that's not really important. Just know that from clavicular intersection towards the humerus, that is cleidobrachialis, and from here, that is your cleidomastoideus. There is no cleido-occipitalis present in the horse, and that's why omotransversalis is completely exposed. Okay, let's remove this trapezius muscle on this side, and then we'll go a little bit deeper into this part of the neck. Okay, once we reflect this cervical portion of the trapezius, you're going to see the serratus ventralis muscle right here. Okay, so that's the serratus ventralis inserting on the cervical vertebrae. Other end of the muscle is attached to the inner surface of the scapula, suspending the trunk between the two scapulae or two forelimbs. Okay, then that's the splenius muscle, which is part of your transversospinalis system. This right here, that's the rhomboideus muscle. As we saw in the ruminants, rhomboideus in the horse also does not have any rhomboideus capitis portion. It has rhomboideus thoracis and rhomboideus cervicis parts only. There is no rhomboideus capitis present in the horse as well. Okay, so ruminants as well as equine, there is no rhomboideus capitis. Okay, so we saw these are then one more important feature here is the wing of the atlas. Like this is the palpable structure which can be even palpated on the live animal. Okay, if the horse is little skinny, you can even palpate it in better way. If the horse is little fat, then you will have to make some efforts to identify any protuberance on that particular animal. Okay, even if you try to identify like tuberous spinous scapulae or maybe you can say point of the hip and all, that takes a little bit more efforts in little bit well-fed animals as compared to the thin ones. Okay. Okay, so that's the wing of the atlas, and just behind the wing of the atlas you're going to find emergence of, or your C2 would be coming off, becoming superficial and giving off different branches. Branches on the ventral aspect, branches on the dorsal aspect. Okay, so that's regarding this structure. So let's go deeper into the visceral space of the neck. Okay, and then we'll look at the muscles on the ventral aspect of the neck. Okay, we can also look at the lymph nodes which are present in the neck region, and then finally we'll look at some of those like parts of the trachea, esophagus and others. Okay, so let's go back to the jugular groove. So we saw on the other side as well as on this side a little bit better way that the ventral border of the jugular groove is formed by the sternocephalicus muscle or sternomastoideus muscle, and dorsal border is formed by the clidomastoideus or brachiocephalicus muscle. Okay, but when you go to the proximal part of the neck, or we can say cranial half of the neck, we can see there are some muscle fibers which are running obliquely just below the external jugular vein, and those are muscle fibers of the omohyoideus muscle. Okay, now we have seen this muscle in the ruminants. The muscle wasn't very well developed or well formed, but it is still present, and also present in the cranial half of the neck. Okay, so that's your omohyoideus present in the cranial half of the neck, and the other attachment of the omohyoideus would be right on the hyoid apparatus. Okay, so it comes from the shoulder region deep to the omotransversaris, and then it runs obliquely and goes to the hyoid apparatus. So what it does in the cranial part of the neck or cranial half of the neck, it forms the floor of the jugular groove, or it forms the medial border of the jugular groove. Okay, sometimes it might also prevent entry into the damage to the common carotid artery while we do some sort of injections into the external jugular vein. Okay, so what we saw just now, that is the omohyoideus muscle forming floor or medial border of the jugular groove. Okay. Okay, now let's move to the ventral aspect of the neck, and then we look at the like usual strap muscles that we see in okay. So here we have the sternocephalicus originating from the manubrium sterni going to the mandible, and so it can also be called sternomandibularis because there is no sternomastoid portion present in the horse. We have two muscles right here, one on each side, that is sternothyrohyoideus on this side and sternothyrohyoideus on the other side. In the horse, sternothyroideus and sternohyoideus, both of those are fused to each other for a certain length, and then they would separate from each other. Close to their insertions, the muscles would separate from each other, but from their origin to the middle part of the neck, those muscles would be almost fused with each other, and they would be considered as sternothyrohyoideus. And then later you can then see the part which is going to the hyoid apparatus, that is called sternohyoideus, and the part which goes or which ends on the thyroid cartilage of the larynx would be called sternothyroideus. Okay, and usually this you often come across this one like when you want to do anything on the trachea. Okay, the muscles are very thick in this part of the neck. So in order to access the trachea, you have to go much deeper in this region. But while if you do it right here, then as less dissected as possible. Okay, so your thyroid gland would be present somewhere here. Okay, you can palpate the larynx, and just behind the larynx you can palpate the thyroid gland as well. Okay, then we have this is your that's your sternocephalicus muscle. The tendon of sternocephalicus goes through the carotid salivary gland and it inserts on the caudal angle of the mandible, or you can say on the caudal aspect of the ramus of the mandible. Then we have external jugular vein splitting into lingofacial vein and the maxillary vein. And then this part here would be the caudal border of the mandible. And this particular triangular area between the caudal border of the mandible, tendon of insertion of the sternocephalicus, and lingofacial vein, that is called Weiborg's triangle. Okay, VIBORGS apostrophe S, Weiborg's triangle, and that triangular area is considered to be the place for surgical access to the guttural pouch on that particular side. Okay, so if I try to put something through this area, I'm going to reach the ventralmost part of the medial compartment of the guttural pouch, and that would be very helpful in draining the guttural pouch. Like if you just don't want to flush it, but if you want something to always like drain out of the guttural pouch, then you're going to make opening here and leave that tube, or you might just pass the sit-on like inside the guttural pouch, leave it there, let it soak up all the fluid, put it outside, put it away, put the second one, put it away. Okay, so those things would be done like when you want to surgically access the guttural pouch. Non-surgical access could be done from the nasal cavity. You can really go from the pharyngeal opening of the auditory tube or guttural pouch, and you can really pass the endoscope or even tubes like in order to flush that. But this one would be the surgical access for that. Okay, but we'll look at that one again like we'll look at the head for the features. Okay, just look at this.